In combat sports, fighters push their hearts to extremes. Rapid bursts of adrenaline, dehydration from weight cuts, and sometimes stimulants from supplements or prescribed medications. That combination can unmask dangerous conditions, things like long QT syndrome, hypertrophic cardiomyopathy, or pre-excitation syndromes like Wolff-Parkinson-White. Now, a simple EKG done the right way can catch all of these before tragedy strikes. This is the reason why all athletes should be offered an ECG as part of their annual sports physical. For anyone who doesn't know, an EKG is the same as an ECG. All right, the international criteria for ECG interpretation in athletes is the global standard used by sports cardiologists and ringside physicians to separate training-related changes from true red flags. Here's how it breaks down. First of all, normal findings. Then we've got our borderline findings. These are acceptable if there's just a single one. Then we have our abnormal findings. Now, these require workups. Now for men, a QTC of 470 milliseconds or more requires evaluation. For women, the value is 480 or more. Now, things like weight cuts, electrolyte imbalances, or stimulant use can all push a borderline QTC into the danger zone. So never ignore that number. There are also clear red flags that should stop a fighter from competing. If a fighter presents with syncope, chest pain, or palpitations along with an abnormal EKG, and ST depression or pathologic Q waves, lateral or inferior T wave inversion, QTC over 500 milliseconds, pre-excitation or Brugada pattern, if any of these appear, you have to pull the fighter. It's just not worth the risk. Now, reading fighter EKGs isn't about being a cardiologist. It's about recognizing patterns that don't fit. Stick to the international criteria. Always cross-check symptoms, and when in doubt, pull and refer.